So let's look at COVID then. And this is basically a systematic review and meta-analysis of vitamin D. There were hundreds of studies done during COVID. I have to say, most of them were abysmally badly designed and perhaps need to be ignored. But this looked at all of them. And the quote from the paper is vitamin D supplementation did not reduce major health related outcomes like mortality, ICU admission rates, or mechanical ventilation. But it goes on to say, the studies differed significantly with respect to their design, the drug dosage, and the population characteristics. So are some of them from a malnourished population, some of them from an adequately nourished population. The intrinsic heterogeneity of the included studies and small sample sizes make it difficult to interpret and extrapolate this data to a large population. So we're not getting no general advice based on the studies that have been performed. Now, what has been recently shown, and I think it's important to see, is that giving large doses is not the answer. You can't get someone who is deficient in vitamin D and just shock their system with a huge dose. So this was looking at a single high dose of vitamin D in COVID on length of stay or the actual severity of the disease. And it was 200,000 international units of vitamin D given as a bolus. And what they found was that it did indeed increase the blood level up to the sort of level we'd seen giving statistically important positive results. But there was no difference. There was no statistical difference in in-hospital mortality, admission to the intensive care unit, length of hospital stay, or the need for mechanical ventilation. So this again is, people have been using studies like this to build a story. Vitamin D is not important. So this was a little bit later, and it talked about vitamin D. Where are we now? Let's look at it and see. We've seen all of these studies being rushed into print, and they seem to be so wildly different one from the other and coming up with different conclusions. So they reviewed 11 of these randomized controlled trials and its impact in COVID. Again, they said they were so different, wildly different one from the other. 5 did have a placebo control. 6 were open label. In other words, they were just giving the vitamin D. Everybody knew whether they had it or not, or single blinded, where either the doctor or the patient knew and the other person didn't know. There was a wide range of sample sizes. Some of them had only 30 patients in their study, and others had up to 500 or 600. So various lab measures of vitamin D were used. Now, I have to tell you, there's really only one validated measure. Some were using vitamin D itself, looking at that in the blood. That has a half-life of 1 day. That is very inaccurate. 25-hydroxy-D is the measure of choice because it'll probably last up to 3 weeks in the blood. 125-dihydroxy-D is the hormone that vitamin D eventually becomes, and it again has a much shorter half-life. So because of the variety of outcome measures, then you have another complicating factor. Some looked at mortality, some looked at length of hospital stay, some looked at the need for intensive care, the resolution of symptoms, or whether they cleared the virus. Some looked at a number of these, some looked at only one of these. So the conclusion where we are now is the lack of a consistent protective signal from randomized controlled trial reporting so far is reflected by the absence of any recommendations. So nobody has been able to say you need to take vitamin D and this is how much you need to take, this is how much you have in your blood, because there have been such wildly different results from clinical trials. This is a very recent study that has looked the really most severe outcome measure is mortality. And that was what was so disturbing and concerning in the initial stages of the pandemic. And this meta-analysis quite clearly shows that there is a significant reduction in mortality. So there are 19 randomized control trials they found, and they weren't biased. We'll talk about bias in a minute. So they seem to be free of bias. And there was a significant reduction in all-cause mortality because some people who died of COVID were actually dying from the diseases they already had. Whether they had heart disease, they could have a sudden cardiac arrest, etc. But vitamin D seems to reduce all-cause mortality by about 28%. But when you looked at the very severe cases, the people who had severe disease, did they die or not? The reduction was dramatic. It was 43% reduction. So there is definitely a role to play of vitamin D alone.